All right. Well, let's start. Group, as you know, this is a little different from our usual meeting, and we're going to have an author interview with an opportunity to ask questions of the author when we're done. And we're lucky that Peter Zakaria has agreed to interview Dr. Lam. Peter is an ophthalmologist, as you all know, specializing in glaucoma, who's been in private practice here in Worcester for 27 years. He graduated from the New York Medical College, where he also did his residency, followed by a fellowship at Tufts. He and his wife Maureen have two adult children, and he has been with our book club for the past 6 years. Dr. Andrew Lam is a retina surgeon practicing in the Springfield area and also is an assistant professor at UMass Medical School. His undergraduate degree is in history from Yale, and he went to Penn for medical school and the Willis Eye Institute in Philadelphia for his residency and fellowship. He's the author of several books and resides in Longmeadow with his wife and 4 children, and he was elected selectman in 2024. Welcome.
Thanks.
And
Thanks.
Peter, take it away.
Okay, great. Yeah. So Andrew, I know you've written a few books, and I've read one of your other books, Masters of Medicine, which I enjoyed tremendously, and I encourage others to read it. And hopefully, we can review that book and discuss it in our book club in the future. I just wanted to ask you a few questions before we start discussing this specific book. What got you started? Like, how and when did you get inspired to write your first book?
Thanks. Yeah, well, thank you all for inviting me and for reading Saving Sight and for being here tonight. My first book actually wasn't Saving Sight, believe it or not. I grew up in this middle of Illinois, just to tell you a little bit about myself, and I was really into military history. Like, that was the thing I loved more than anything. I went to college and studied military history, where I focused on World War II and China, actually, because I felt like a lot of people knew a lot about World War II, but they didn't really necessarily know what all the Americans were doing in China during that time. And then I decided to go to medical school, not history grad school, and mainly because my father was an interventional cardiologist in our hometown in Illinois, and I had grown up just seeing how fulfilling I could see his career in medicine was very fulfilling, basically. So I wanted to kind of do the same kind of thing. I didn't necessarily want to work quite as hard as him, so I became an ophthalmologist like Peter, but basically I was drawn to ophthalmology. And I remember when I was a resident, this is how my writing career started, because believe it or not, I never dreamed I would be a writer. I think my English teachers were shocked that I became a writer because it wasn't really my favorite subject back in the day. I remember thinking in the late at night in the ER at the Wills ER one night, it's really a pity I cannot share all that I know about World War II and China with people. You know, I don't have time to write a nonfiction book. I'd done a lot of the research already for my senior thesis in college, but I didn't have time to like read the books, travel to China, interview all the veterans. I was a resident. It was a busy time. I had 3 kids at that point. But then I thought, what if I wrote a novel? You know, I guess I'd watched pretty much every war movie ever made. I think that probably was a fair assessment back 20 years ago. And I said, what if I dreamt up a story that I could use to convey the history that I really wanted people to know? Because as you know, China was America's ally. China was a very important theater of the war, primarily because hundreds of thousands of Japanese soldiers were occupying China. And if China capitulated, then all those Japanese soldiers would go to the Pacific and oppose the Marines trying to go in an island hopping campaign. So Americans were sent to China to help the nationalist government and even interact with the communists in their combined fight against the occupying Japanese. And that's what I did. I started writing a novel called Two Sons of China. I have the cover here. It took a very long time. I got a book agent, which was a big deal. It took a long time, and I finally got this book published. And it's basically a novel of World War II, and it was very gratifying to do that. And what happened with Saving Sight was, you know, when you have a book agent, you are suddenly spending all your time thinking, what else could I write about? Because now you've got something very valuable and you don't want to waste it. You know, you have access. You have access to publishers, essentially. So I remember thinking, what else could I write about? And I was a very historically minded ophthalmology resident, as you can imagine. And I had learned all about these heroes, most of them unsung. General public did not know about them. And if you've read Saving Sight, you can see why I found those stories so enthralling. And I went to my agent and I called her up and I said, I've got it. I've got the idea for my next book. You ready? I tried to build it up. And I said, I want to write a book about ophthalmology's heroes. And there was like complete silence. And she, as tactfully, I could tell she's very good at being tactful because she's a book agent. She lets most people down. But she was basically letting me down. She's like, there's no way, basically in a nutshell, this is not going to work. And I'm like, why not? And she goes, well, because I just don't think the general public's going to be interested in a book about ophthalmological history. And I was crestfallen. Of course, I knew she was right. She doesn't want to waste time with a book that's not going to sell. I guess I shouldn't waste time writing a book if no one's going to read it. But I didn't want to give up on these stories because if you've read about Ridley and Scapins and Pats and all these guys, you just want people to know about their stories, which are just inspirational. So that's when I said, what if I blended the history with my own story as a resident in training, learning how to do surgery? Because one thing I was pretty good at by that point, as all of you who are physicians know, you've written a lot of personal essays. Like you wrote essays to get into college, to med school, to internship, to fellowship, you know? So I was decent at writing about myself. And I said, what if I brought people into the operating room to see what it's like to try to save sight, or perhaps more interestingly, what it's like to be up against a difficult complication or situation. And Peter, as a surgeon, you know, like there are times when there's no good options. You're just trying to choose the least bad choice, essentially, and show people what it's like to save sight, or perhaps more interestingly, what it's like when you're not sure exactly what to do, and just be honest about it, because surgeons are just as human as everybody else, as people on this call know. So that's what I did. I was very honest about what it was like to learn surgery, ophthalmology, to deal with difficult news, like telling people they're blind and never going to see again, things like that. And that's what made Saving Sight successful. So even though I wrote Two Sons of China first, Saving Sight actually was very quick to get a book deal. And until my last book, it was by far my most successful book, because it's kind of a niche book. You know, there's no other book like it. And it's very gratifying to still get, like, you know, med students literally from all over the world will email me and say, you know, I read this book, it inspired me to go into medicine or ophthalmology. So that's really great. But for me, it all goes back to this love of history. And a lot of the stories from Saving Sight, of course, were from military history, which is my love, of course. So to answer your question in a roundabout way, that's kind of how Saving Sight and how it came about, and that's how I started writing.
Yeah, and I thought you blended in your own stories very nicely with
Thank you.
the chapters on the different physicians. And did you have any particular authors who you felt influenced you? I mean,
Sure.
there are other
Yeah.
ophthalmologist authors. One of the famous
Yeah.
ones is Robin
Robin,
Cook,
yeah,
but it's
he's
completely different.
you know, as it's very humbling to be a writer, because I know, you know, I have a fair assessment of how good a surgeon I am, how good a doctor I might be. I might tell my wife what I honestly think. And the same goes for being a writer. So I'll be sitting at home and sometimes I'll be reading a book and I'll just put it down and I'll just go, sigh. And I'll tell my wife in a very sad voice, this book is amazing. Will never be as good a writer as this person. You know, often fiction books are like that. And so, you know, Robin Cook is a great writer. He's a really thrilling writer. I would never be able to be a writer like that. But I have everyone has their own style, you know, and I've recently written more nonfiction lately. I wrote Two Sons of China, then Saving Sight. I wrote another novel of World War II called Repentance, about Japanese Americans, which is this book. And it was very gratifying that this was a finalist for the Massachusetts Book Award, which was kind of like reassuring to me, because as a novelist, I had kind of a little bit of imposter syndrome for a while. But I think that, you know, I think the book, they basically follow from my passions, I guess I would say. And yeah, I'm not sure if that answers your question.
No, that's yeah. With this saving site, uh, is there any one of the people you write about who sort of stands above the rest? And I mean, I know you're a
Sure.
retina specialist, and you might say Scapins, but they're all pretty amazing. And certainly
Well,
Judah Folkman is a pretty amazing guy. And but
absolutely.
yeah,
I think that, but without a question, I think everyone's favorite per story from the book is usually Harold Ridley.
hmm,
And I wrote the what was it? The 80th anniversary of 49. I mean, the 75th anniversary of the intraocular lens
hmm,
was an anniversary this year. I was able to write a Wall Street Journal article about it to
hmm.
kind of highlight him.
I
And
read that. Yeah.
thank you. The reaction to that was amazing because people loved that story. So if you haven't read A Saving Sight, if you have, you already know this story, but very briefly,
Mhm.
this Harold Ridley was this unassuming, very shy, quiet guy. Nobody ever assumed he would be like, he wasn't a self-aggrandizing self-promoter at all. He was just the kind of guy who sits in the corner of your med school class. Nobody knows how smart he is because he never speaks up. And he noticed during the Battle of Britain, this pilot who had shards of plexiglass from his downed hurricane plane, the canopies that had the shattered canopy, the plexiglass had gone into his eyes, and he had managed to parachute safely to the ground. And Ridley examined him and saw the pieces of inert plexiglass in his eyes, and he knew this was a very special situation. And later, it inspired him to think maybe I can replace the cataract with an artificial lens made of plexiglass, which is clear and the body won't reject it. So that's the real reason that's so amazing is because he was ridiculed his whole career. He thought his career was a complete failure when he retired. So to me, that's one of the favorite ones. You know, I thought of a couple books that you asked before about authors. Not necessarily doctor authors, although some of my favorites are like um, the guy who wrote Emperor of All Maladies, Mukherjee, is great. But I was inspired to write historical fiction by authors like Jeff Shara, who wrote Gods and Generals, Last Full Measure. These are like these are Civil War books written in a very, very effective way. I love Ken Follett. You know, Ken Follett wrote Pillars of the Earth and a ton of other books. He's a British author who's just super successful. He just has a way of writing in a very gripping way. And I have a lot of other favorite books as well. But yeah, I love reading history.
Yeah, Ridley. I was surprised. I didn't realize Ridley was such an accomplished uh, ophthalmologist. I mean, he it worked with onchocerciasis,
Yeah.
and I didn't realize he sort of butted heads with Sir Duke Elder, who's one of the greats
Yes.
of ophthalmology. And I really didn't realize it, but there was a sort of a common theme among the people you write about here, and a lot of them weren't taken seriously, and there was a lot of controversy surrounding what they did. Charles
Yeah.
Kellman, and sort of operating in secret, and
Hmm.
I don't think that would fit in today. I think
Yeah.
today these guys would get into a lot of trouble.
Very much so.
Yeah, and if anything, they wouldn't be able to document their care in Epic, which would really doom them to.
Yes, it would just take too long.
Yeah. Anyway,
Yeah,
yeah, maybe.
that's
Yeah. Go ahead.
that
Sorry.
story. Like there's and in my Masters of Medicine book, it's full of the same kinds of stories of these doctors who risk so much to give us the tools we have, right? I
Sure.
mean, in my book, The Masters of Medicine, which is what it looks like,
Yeah.
basically, there are surgeons who there was this like these doctors who did the first open heart surgery. There were Dwight Harkin and Charles Bailey were these rival surgeons after World War II who got experience kind of taking shrapnel out of the heart of wounded soldiers, like the first open heart surgeries. This was like the beginning of it. And like Charles Bailey was a surgeon who tried mitral valve commissurotomy, which is like a beating heart surgery where you have a fibrosed mitral valve, you make an intentional incision in the left atrium and have a purse string suture to tighten the hole around your finger to try to limit blood loss, and you're just poking your hole through the mitral valve and trying to open it up, open up the leaflets, okay? And like he killed a couple patients at his first hospital. They revoked his privileges. He killed another patient at another hospital. Uh, like, you know, they took his privileges away. His last chance to do the surgery was he scheduled 2 surgeries in different hospitals on the same day, hoping that if the first one died, he would be able to start the second one, have one more try before they also revoked his privileges. Those are the only hospitals he had privileges at. If this didn't work, he would be literally, his career would be over. They were literally risking their careers to prove the point. It's just amazing. It's mind-boggling.
Yeah, it really. Yeah, I also enjoyed how you blended some good anecdotes in that book as well in Masters of Medicine, and it really made the book very readable. But
Thank
yeah,
you.
maybe Dale, should we open this up to the other participants to ask questions and give us their impression of the book?
Sure. I would say, is there anything else, Andrew, that you would like to say now before we open it up, or are you okay?
I'm happy to answer questions. Yeah, I can
Okay,
talk about
great.
a variety of subjects, but I also love medical history, as I know everyone in this group does.
Yeah,
I'm sure that most, if not all of them, were physicians, I assume, but I mean, I'd love to hear their stories of what they saw in their careers or what they're seeing in their careers that has changed. I mean, I could talk a long time about what retina used to be like and what retina is like now, which is
yeah,
my field. Like how when I was a resident, we had nothing for wet macular degeneration. We just tell people, I'm sorry, I'll see you in 6 months. And you're going to lose vision from this. Or maybe I could offer you a laser treatment, which will actually worsen your vision today. But the studies show in the long run, you'll have more vision than if we didn't do it. I mean, it was a terrible sell. I'm sure, but now we inject people with anti-VEGF injections and save their vision, So
That
I'm
that,
sure
that
this
was a
group
real
is
game
full of
changer for
people. Yeah.
ophthalmology. Yeah, I mean, so many more people are seeing with the development of
I think that
these
would be fascinating if
medications.
everyone took
Yeah,
2 minutes to like share what's the most amazing thing that they saw in their career from the past to the present,
yeah.
I think that'd be really interesting.
I just to, one thing I would like to bring up is just first of all, I thoroughly enjoyed this book, but I think the parts that I enjoyed were the fact that you were connecting your practice to history,
Mhm.
and in addition to that, you rolled in some health policy in there. You
Yeah.
talked about here's how the system works, and rather than talking about it in the tone that we so often hear from other physicians, which is kind of I wish those people would get off my back. You really just said here's why it's happening, and you just try to understand why we're in the world we're in right now, how it got this way. I thought that was really nice, and you also brought back the fact that going through all of this, you consider it such a privilege to be a physician, and that we are, despite managed care and everything else, we are in a wonderful profession, and so that was inspirational. I would recommend your
Yeah. I
book
mean,
to
I might.
people in residency or early career who are being hit by new things and are wondering.
I mean, I agree. Those really resonate with me. I think, I have kids who are thinking about going to med school, and I tell them it has to be a calling, because if it's not a calling, if you're not like really motivated to help people, uh, this is too long a road and it's too laborious, it's too arduous, I think most of us, we have a lot to gripe about as doctors, but we're so lucky, right? Like I'd honestly do this job for half the money that I get. We're just really, really lucky.
Hmm.
Because fundamentally we get to help people. And I mean, we all have colleagues who are doing other jobs that they do it just for the money and it's not very fulfilling. And, here's an example. You talked about how I write about policy. I I I actually am involved in government, local government. As you noted, I'm a selectman and I deal with government. And I kind of just, started out in my town in Longmeadow being really interested in finance because I'm really interested in like how money is spent and really want to make sure our taxpayer dollars are not wasted, essentially. So I was a finance committee member in our town for 9 years. I was the chair of the committee. I've been on the select board now. And my next book that I just signed the book deal for is it's about the unintended consequences, the history of unintended consequences in history, literally. And so many of these things are government related. In medicine, I'm going to probably write about like electronic medical records,
Oh yeah.
and PQRS and MIPS quality is like, there's so many good intentioned bureaucrats, people, but the things they do backfire. And
Yeah.
it's like, what kind of commonalities can we find in government, in business, in ecology, in military strategy, in medicine? There's so many things to write about. So that's kind of the part of my passion that you saw in Saving Sight, but is literally going to be a book that I'm about to write. And I just think that I just have a passion for just plain speaking about what's going on. Like if you saw my Facebook page in my town, it's just telling people the way it is. Like, oh my God, just like every town in Massachusetts, we're a historic town. Our DPW is like underwater with like century-old pipes and sewers and water pipes. And how are we ever going to get on top of this? And we're just never going to really. It's just we're just going to try to leave the town a little better when we leave than when we started, if we can, just try to triage things and get things to be as take care of the most emergent things possible first, essentially. So there's a lot of interesting things. Obviously, like a lot of people here, I'm kind of like, you're all lifelong learners. So that's really what I think keeps life interesting, I think. So
Yeah, well, certainly the idea of unintended consequences is should be page one on every medical textbook. So that's a great theme. Yeah, excellent. Others, do we have any others who would like to either comment on their experience reading the book or ask a question? Let me get this up so I can see you better. Okay, Michael.
Okay, yes, I definitely enjoyed the book. I'm an infectious disease physician, and we have an infectious disease posse here. I see three of my colleagues.
Cool.
And I've been at this for almost 30 years, and coming from the HIV epidemic and the evolution of good treatment, remarkable treatment, to COVID, and now to the age of RFK Jr. and the rejection of all the progress that we made is an interesting story. I don't know who could tell that well, but I enjoyed the book. One thing I noticed in the book was that you stressed that I thought was very interesting was serendipity, whether it was the plexiglass in the eye or the dental chair and the story with the phaco emulsion or Judah Folkman's things. And I haven't read your other book, but the famous story about Fleming and the and the fungus and penicillin. I think serendipity
One
is
of the
so
best
important.
serendipity stories. That's in that's in Masters of Medicine. I
Yeah.
actually got 2 infectious disease chapters in there. I
Yeah.
learned a lot, bacterial and viral. Is
And
what I'm talking about.
I was curious about how you did, so much research, and where you had the time. Did you travel a lot?
So like for Masters of Medicine, I really felt well poised because I loved reading history, like secondary sources. Some of these topics, like for example, penicillin or the story. I wrote a lot about rivalries between like Louis Pasteur and Robert Koch, which was an incredibly vitriolic rivalry that I loved to write about. Or like Jonas Salk and Albert Sabin, they also had an incredible rivalry. So there were some secondary sources that were good, but often these books about medical history were written by journalists, or like they're not written by historians. I mean, sorry, they might have been written by historians, but they're not written by physicians generally. And so I was able to like look at the actual papers. And so being part of UMass was fantastic. Like I can ask for an article from the university, like from Scotland, to read Lister's original papers about like putting carboxylic acid on like wounds so he doesn't, to like prevent to create asepsis and understand it. Or like General Garfield, President Garfield's assassination I'm writing about. And I like literally after he dies, his physicians fill like the biggest journal of medicine in the time with like hour by hour reports of their notes over the 2 months it took for that guy to die, to kind of defend themselves. But at least I understand what's going on. And you read the secondary sources and you realize the journalist or the historian who wrote this didn't really understand exactly what happened here. So that was just a joy, right? Like I'm lucky I don't have to write for my living, which I think would be very frustrating. I only write about things that I am super passionate about so that, I can't wait to jump out of bed to research and write. And so those ideas don't come all the time. My wife calls my writing the other woman because when I get an idea, I'm gone. I'm like, she doesn't see me. I stop watching a movie every night like I don't normally do, and stop binge watching all the shows. But look, so that's kind of the way I feel about it. I'm sure you all have passions. Um, I think that's what makes work bearable, right? Like we're lucky to be doctors, but it's still a job, and I still prefer vacation to having a job. But the other things that we do outside are what really keep us, happy, right? So it's all multifaceted. Um, so the research is just something I love to do, and I'm lucky, like the internet and the library, interlibrary loans, and just PDFs of articles that I request from journals, or the most obscure journals ever. They literally show up within 24 hours as a PDF in my computer because the library is so good. And so that's fantastic.
Have you been able to interview people as well in your writing, like interview some of the people who were primarily connected to some of the historical figures?
Sometimes. So like the Masters of Medicine is basically the story of the greatest discoveries in medicine over the last 150 years.
Mhm.
And most of those people are long gone. But like an occasional thing, like I wrote a chapter about cancer, and one of the big parts there was about immunotherapy. And the first person who was ever treated and cured with immunotherapy was a patient treated by Steve Rosenberg at NIH in like 1984, I believe. And so an anniversary of that came up. And so like last December, I think I wrote an article for USA Today, and I actually hadn't talked to him before when I wrote the book, but because of that article, especially because I wanted to like him to know, hey, there's this big article about literally you as a hero coming out. It was great to like connect with him. Um, but it was rare to actually know somebody who I wrote about. I did interview Nicholas Ridley, who's Harold Ridley's son, who I can't tell you how emotional he got just trying to convey to me how depressed his father became after his career ended because he really felt he had wasted his whole career. I did meet Arnold Patz once at an Academy of Ophthalmology meeting, but I didn't really know him before I wrote the book. I did communicate with his wife, and I communicated with the wife of Judah Folkman. The spouses read the chapters. I wanted to
Hmm.
make sure there wasn't something, and Charles Kellman's wife also read Kellman's chapter. I just wanted to make sure they didn't think I got something horribly wrong. Like, and
Hmm.
they all were very grateful that I had kind of helped to, perpetuate the stories of their loved ones.
Yeah, the experience of connecting with them must have been
Yeah.
pretty
Oh my God.
satisfying. Yeah.
Really amazing. I mean,
Hmm.
it's a privilege to tell this story. The stories alone are just so inspirational, right?
Mhm.
And then to hear from but what's most touching is how grateful they were. Like nobody knows who Arnold Patz is, or very few people in the general public know who Judah Folkman is. But the spouses were just so grateful that I was doing something to help, you know, burnish their legacy or just make it people aware of it. So, and I've made this point before in many talks I give. We pay a lot of attention to athletes and movie stars, but how much more do we deserve to laud and thank these scientists, these unsung heroes who literally changed our lives? Like another, here's one wonderful person who I interviewed for my book was Catalin Carrico, who, as you know, especially Dr. Newstein here, we mRNA vaccines, COVID vaccines. She and Drew Weissman basically did some of the landmark research, and so she was somebody at Penn who I was able to connect with and showed the chapter. And she was also like, these people have done so much, but she wasn't famous. I talked to her before she won the Nobel Prize. She's just her whole story is just a journeywoman, uh, researcher from Hungary who like nobody paid attention to. And after communicating with her, I'll be honest with you, her English isn't that great. So I can see how many meetings were we in med school or residency or beyond, where there was like, a foreigner who we maybe didn't hold in such high esteem because they had trouble communicating. And I could see how she had maybe not gotten all the grants that she applied for. And frankly, she got no grants, which is the part of her drama of her story, because her writing wasn't that up to par, you know? So it's just an interesting reminder to just look a little bit deeper into people's qualities. Don't just take your first glance and just judge them, essentially, because she was somebody who, thank God, she persisted despite so many setbacks, because she changed the world.
Oh, that's a great story. She was in your other book. Yeah.
Excellent.
Julie, I think the youngest doc here. I finished residency at UMass Family Medicine in 2020, and Dale very kindly did not kick me out of the book club when I moved to California.
Cool.
So, one of the things that is both fascinating and also daunting about looking into history of medicine is, we see a lot of the things that panned out, that worked, like Ridley panned out, Pates panned out, like all of these things worked. The things that however, I think you had one line inserted somewhere about, alluding to the hundreds of drugs under development that never worked, and those were tossed out. The stories that you selected for this book were a lot of the controversial lone wolves, basically.
Yeah.
And it's great to look back on that, but if you're in the moment, history hasn't yet happened.
Yeah.
To have people who are totally convinced that they have it right and they are dead wrong.
That's right. That's probably the majority of them. But we don't write books about the losers. But that's a great point.
Yeah, and it's just interesting, and I don't have an answer to it yet, and it probably never will. How do we know who's gonna be right?
So let's see. I get asked this not infrequently. People will usually say, yeah, I mean, they'll say something like, could the discoveries that occurred then occur now? Like, could this German intern who was the first guy to catheterize the heart, who literally defied his bosses and like catheterized his own heart essentially in the 1920s, could he do that anymore? And so the answer is probably not. So the answer to your first part of your question is there were definitely charlatans, quacks who did very bad things, and they didn't work in the past. But what the converse of that is today, I think that is very much less likely to happen because of our ethics, because of our research protocols. But it's much harder for that maverick to really have the capital or the resources he or she needs to innovate, I think. So, there's no way I'm going to, I don't know, our generation, I mean, you're younger than me, but my generation is like, there's no way I'm going to really want to be the first doctor in the history like Charles Kelman to try a new device on a patient, even if I got informed consent, which I felt was ethically up to snuff. I really think that it would just be too risky in this day and age. I would never do that. So I think today we're in a situation where it's less likely we're going to get quacks, but it's also less likely we're going to get those rare mavericks who really change the world. But I am sure you're correct that probably 95% of ideas weren't necessarily harmful. They might have been like, radium, like the things we didn't know, like, the radium girls who were like licking the radioactive stuff to like make glow in the dark watches, or even Marie Curie didn't even realize what she was doing, so and then people thinking, oh, we can use mercury to cure syphilis, or how many other snake oil salesmen were out there? There were a lot.
I have a comment on that. Don't you think, though, that industry sometimes leads us in the wrong direction? I mean, I look at my own field, treating glaucoma, and some of the devices that have come along and not proven, but were, heralded as, this thing's great. I mean, we had a thing called holmium sclerectomy when I was a fellow, which used a laser to make a small hole in the sclera to treat glaucoma. And I remember some of the disasters that came out of that. And yet these were, heralded as, the greatest thing since sliced bread to treat this. So do you think that maybe, industry
Yeah,
and profits are
absolutely. The
lead us in the
conflicts
wrong
of
direction? Yeah.
interest, the conflicts of interest are huge. So we have a pretty significant research center in my practice, and retina research is very, very robust, primarily because there's a lot of money to be made to treat conditions like macular degeneration and macular edema from various conditions like diabetes or vein occlusions. So there's been so much innovation in retina, and I do, I'm kind of really, I've written a lot about ethically minded stuff. Like you read about Avastin versus Lucentis. Now this is like 12 years ago. And a few years after Saving Sight came out, I wrote a Washington Post article basically saying, why are we using $2,000 Lucentis when $50 Avastin does just as good? That was I was risking a lot by writing that, because I felt, because I think a lot of my colleagues around the country would have a very dim view of people highlighting this, because there's a lot of money to be made as doctors by using the more expensive drugs. Now, there's half a dozen more medicines like Lucentis. You've seen commercials for them. Obviously, they make so much money. I assume that they can have national ads for Vabysmo, for Eylea HD, for Izervay and Syfovre, So I'm very cognizant of the studies that I'm a part of, that we're being driven by drug companies that pay $1 billion to get the medicines to market through the trials. And I'll be honest, I secretly am happy. I can't believe I'm admitting this. When a phase 3 trial doesn't work, even though I know that maybe the phase 2 stuff will look really promising and their stock has already gone up so much, but when it fails, I say to myself, thank God there's still some integrity in this system. You can't buy an approval. Like, this is at least a little bit of a modicum of confidence that our system works well. At the same time, there are drugs out there, I'll tell people, for example, these injections for geographic atrophy for dry macular degeneration just came out. The FDA approved them. I don't think Europe approved them, because when we were part of the studies, the results were so modest. These are injections in the eye for dry macular degeneration. It's never had a treatment before, but they of course are just basically looking at the data, finding anything they can possibly show that might be statistically significant. Vision was not improved, but they measured the geographic atrophy a certain way so that they showed there was like a 18% decrease in the treated group over time compared to the control group. But it made no difference. The big controversy in our field is, did it actually make any difference in people's vision? Well, it doesn't really matter because the FDA approved it. So now people are using it.
Yeah, that actually kind of blows my mind. I mean,
Yeah.
the endpoint and the success was defined as an anatomic success without any functional success, and
That's
yet this
right.
is something you're committed to getting the rest of your life at a humongous cost, and that's an example of
Right. I mean,
problem
at
right
some
there.
point along the line, the FDA's role changed from safety. So we just need to make sure whatever is out there is safe, to efficacy. We not only have to know that it's safe, but actually that it works, right? But then if you think about how does something work, like on one side of the spectrum is things that work really, really well, like mRNA vaccines. And then there's other stuff that's like, probably it does confer some benefit, but it's not a lot. And question is it worth the risk of the side effects? But more importantly, is it worth the cost to the healthcare system? And that's where our society is. Most people know. And I can say, I guess I'm a politician now. There's a lot of issues with politicians making good policies because there's something called public choice theory. If you guys have studied economics, it's like politicians don't always make the best decisions because we're motivated by self-interest. We want to accomplish things, have like little feathers in our cap, and we say, let's do this policy. And I'll like increase my influence or look good to my constituents, but it's not necessarily the best thing for my town or my country or my government, you know? So this is a problem in government, and this is something we see all the time
Mhm.
in medicine too.
I guess, you had mentioned the idea of unintended consequences, and I think conventional medicine is almost defined as the widest accepted approach to a particular problem or whatever. It's what other reputable people do. And so if someone proposes something that is new and disruptive, then the almost by design, the reflex is to make it harder to get in. And that on the one hand is the safety valve for the system, and on the other hand, it can delay or suppress progress. At least from my point of view, it's almost every great discovery. It's unusual to see something that is disruptive and is rapidly accepted.
I agree.
Yeah,
I think I mean I think about all the people in Saving Sight who the establishment opposed them, right? Practically every single person. And that's the same in regular medicine,
yeah,
to be honest. Like, but there are some things that are just so great that people adopt them immediately. I'm thinking of like, and Andreas Grunsig was the guy who developed balloon catheterization. And when he could show the angiogram with the coronary artery, the distal flow, literally he was opening it up. It was in the 70s. It was just like, oh my God, that works right away. mRNA
mhm,
vaccine, similar. Like, I don't think, I mean, we're all amazed. I don't, obviously it became political, but among medical professionals, I think I was in awe, and I'm sure all of you were too, that this was not, we can use mRNA to like make the thing make whatever we want. The cells
right,
make, that's just the stuff we would read about when we were kids in biology class, but never really thought it would
right.
happen in our lifetimes. And it's just miraculous. It's going to change not only infectious disease and vaccines, but cancer and everything else. So there, if the idea is good enough, um, it's going to be good in my field. So I do a lot of really, really delicate peeling of macular membranes. Like for a macular hole surgery, I have to peel the internal limiting membrane, which is like the most superficial layer of the retina. It's super delicate. Makes you, the rest of the surgery is easy, but there's for like 30 or 40 seconds, you're like sweating every time. And so the way to get a purchase on that internal limiting membrane, we used to have this like diamond dusted scraper, and it's not perfect. You could still be too rough and damage things. So several years ago, someone invented a finesse loop, it's called. And it's basically a very flexible loop with little teeth that don't indent any deeper than the internal limiting membrane itself. And you can like scrape it very safely across the internal limiting membrane and get a small tear in it that you need to start to peel it. And it's a loop that comes out of a staff, and if you push it out, you can imagine if you push it out a lot, it's flexible. So it's not going to create a lot of force. But if you need it to be stiffer, you just retract a little bit, it makes it shorter and it makes it stiffer. And I was like, everybody started using it because this was a problem that only a retina surgeon knew we had. But this was a solution that was so much safer and better.
Mhm.
Immediately, whoever was making diamond dusted scrapers, I don't even know who made them anymore. Whoever had like their stock probably plummeted because like nobody uses them anymore.
Mhm.
So I do think there are times when there's just a solution that's so good, and thank God we have people still making those discoveries. Does anyone have a story from their careers that just astounds them when they think about how they used to practice back in the day?
I mean, I can, not to overdo it on ophthalmology, but, some of the real game changers I can think of too, cataract surgery, Trypan Blue. I remember when I was a resident doing cataract surgery on white cataracts. What we did then, we made a little smile incision in the capsule and we expressed the cataract. And just this little, blue staining device has been a game changer. And
Hmm.
another, just one more, so nobody gets sick of me talking, is if any of you aren't familiar with this, the Malyugin ring is such a nice uh, device which has helped us tremendously, and it's so incredibly simple in its design, and that it's beautiful. But yeah, I mean, we have devices that change things, are real game changers, and just help us a lot. in what we do.
Louis Faison here. Sorry to be late, but happy to be on next to Lynn Eckert. There's so many in pediatrics. I mean, the immunizations just changed pediatrics entirely.
Right.
From when I started as an intern, we had a whole floor of patients with invasive H. flu disease, and we became experts in that. And as time went on, and meningitis was just so common. You were doing LPs every single night that you were on duty, 2 or 3 LPs on little kids, and became very good at it. And I had it later on. I was just doing outpatient pediatrics. I was working in Boston at a health center, and I had a patient with meningitis, and they were able to do the initial LP, but they called me and said we were unable to do a follow-up LP to prove the efficacy of the antibiotic and so forth, to make sure it's sterile. And I was pretty amazed at that at Boston Children's. But anyway, I went over at lunchtime, and the only trick to this was identifying an older nurse's aide from the old days, because the current way of looking at things is if you hold the child too tight, they can't breathe, they're doing an oxygen saturation, that goes down. But if you find an older, I was elderly too, but you find an older aide to hold the patient tight, you can hold them pretty tight. And yes, their oxygen probably does fall, but you get the LP and you get the information you want. And we didn't put any monitor on, so we didn't know exactly. You could say, I'm just doing this quickly, we'll get it done. So something, I think we may have, in the process, we lost some technique also, because the immunizations removed the need to do many LPs, and even,
Interesting.
so we did so many, you just knew every feel of the vertebrae, the L2-3 interspace, and you knew exactly what you were doing. So
I envy your expertise. I was not good at LPs.
yeah. I'd like to mention one thing, that my father and Lynn's too were general surgeons. And one of the things that in the 50s, 60s, 70s, that the general surgeons took a great deal of pride in was the radical mastectomy, and doing a really thorough radical mastectomy, removing everything and trying to do it just right, to have the least amount of disability for the patient, but being very thorough about removal of lymph nodes and tissue, and the radical, and how it was very hard for people that believed in that radical to even think about a lumpectomy. And there's a wonderful history there. It started more in England. We think maybe of George Cryle at the Cleveland Clinic, but it started in England where people were doing that, and someone had to start to do it, but huge resistance against that. It's just, I can see how you could not convince someone who was very good at radical mastectomies, I mean, quote, very good at that technique, the Halsted radical, to try to teach them to do a lumpectomy. That would have just been unbelievable. Can't do that. It's impossible. That was a huge, that was one of those things, I think, that has made a tremendous
difference. We have a compassion bias in medicine, right? Like that's a great example of how, you want to do it best you can for the patient. That's not self-interest. That's not because we're making more money to do the radical mastectomy. It's because you want to do the right thing for the patient. And you're so used to thinking and believing, and this is the way you trained and all your mentors taught you to do this, that this is the best thing to do, and that doing anything less is like it's like a misguided compassion. You're not helping them. And this is what, like, Arnell Pass, when he did that first ROP study, the nurses, he wanted to not give certain babies high level oxygen, and the nurses thought this was like so bad, it was evil. They would like secretly give the babies the oxygen at night and ruin his study until he figured out what was happening. So it's true, sometimes we do things and we're just set in our ways, and we don't realize, there could be a better way, another way. Government's the same way. There's a lot like that.
Thoro, you've had your hand up for a while, so please do comment.
Thanks, Dale. I'm sorry my mic was off. But what I wanted to say is, first of all, I'm the only non-physician, Andrew. I don't know why they let me in. I'm at UMass Medical School working on RNA. But I just wanted to mention, in terms of the last two remarks, Halstead was remarkable also for the fact that, according to the biography that I read, and many of you have read, he went in and conducted surgery still high on cocaine on many
Right.
occasions.
Right.
And
Right.
as to
Sure.
Peter's very thoughtful comment about trypan blue, but my main point, Andrew, is to add another element of appreciation, and that is science for the lay public. I think you've really done a remarkable job of bridging the clinical details and the history of medicine with a way in which the public reader, the general reader, can really get a feeling for the joy of discovery, whether it's clinical or basic. And I want to congratulate
Thank
you
you.
on that. It's been done by others. Lewis Thomas is one name that we revere. But I just wanted to add that quick comment that I think this is another dimension of our appreciation. Thank you.
Thank you.
Yeah, well put. Thank you. Okay, other comments or questions?
Dale, I could,
Yes, CJ.
I want to thank you for picking this book up, and it was a wonderful introduction to a great person that we could have to discuss the book with us. I enjoyed it tremendously. I think the previous speaker just mentioned the way the stories are weaved, for personal stories during the residency program, and the patients, and the history of ophthalmology. I enjoyed it tremendously, and it kind of revived my love and affection for Judah Folkman,
Mm.
who, when we were residents at City Hospital, our chief of surgery will bundle us up in a van and go to the grand rounds at Children's Hospital and mass chapter of a college of surgeon. And I heard Judah Folkman speak multiple times. Such an inspiring person, as is Andrew himself. My question to Andrew is this: it's there are a lot of people who write in their own field, but your interest in wars and the history of wars is, very distant from what you do for a living. And you told us a little bit of your interest. How do you gather all that information and putting these magnum opus? Give us some inkling into that. How do you do that?
Well, you all have passions, I'm sure. Mine's, I feel like I was meant, I went to medical school not because I loved science, to be honest. I I was I have such a love of reading about history and military history
Sure.
that these books that I write, the research is just from a lifetime of reading things I did for fun, or like going to seeking out people, talking to them, going to museums my whole life and things like that. And so I think that it is true. I talk to a lot of young people, and they often will ask, like, how do I find my passion? And I think that if I'm honest, not everyone has a passion, and it's fine. I felt like this was mine, and I'm passionate about being a dad and a husband and being a doctor. But my passion for this military history stuff exceeds like my passion for medicine itself. I mean, I became a doctor because I love people and helping people, and I could do the science, and I of course appreciate it. But I'm not like, if you ask me, would I rather read a book about military history or the latest journal articles about my field? I will still read the journal articles about my field, and I find them interesting, but it's a lot more fun for me to read history, and I'm just that kind of person. But if you ask like some of these, these innovators I write about, like Callan Carrico will say she loves reading about journal articles. Like that's her passion. So I think that I'm somebody who will, I mean, if I think about like what my comparative advantage is, it is to try to convey, like use this humanistic side to convey a window into our world as doctors, essentially, and just give people an appreciation for how much we owe to everybody who's going to be far better and more innovative doctor than I ever can be. And I hope that that helps people, you know, and I just love it. There are things that each of you do that you love, and it touches people. Like people in my town, they're love coaching youth soccer or painting or writing or running marathons. I cannot believe so many people run marathons. When I was a kid, that was like getting a 1600 on the SAT, impossible, right? So now everyone does it. So anyway, I encourage all of you to just think about what you can do tomorrow that is pursuing a passion that's not maybe binging watching TV that I would normally be doing, you know, just something active involving another person, maybe, you know what I mean? It's good to expand your horizons.
Excellent.
Nice
Okay,
to have you here.
Lynn or Louis, there's a hand up.
I want
Lynn.
to ask Andrew, what's been the response to your books and how do you handle the critique that comes with writing?
Great question. So one of my kids' favorite activities is to go onto Amazon or Goodreads and click the 1-star reviews and see what people say about their dad. Luckily, it's almost all positive, right? Because there's the people who are lifelong learners who actually read a book these days, they're not as likely to be the rabble-rousing like bomb throwers that I might get on my Facebook account for my selectman job in town, where everyone's complaining about their road or like everything under the sun. You literally are putting yourself out there. The attack surface as a politician is way higher than an educated person who's writing nonfiction books about history, you know? So most of the feedback is wonderful. It's just amazing to get emails from people like doctors, like all of you, like who will email me and say, I knew Judah Folkman, or I knew somebody that I wrote about. Like one of the first talks I gave after Master of Medicine came out, I told the story of Dwight Harkin, who is a cardiac surgeon who I mentioned from World War II, but he was in Boston. And I gave this talk about the mitral valve and the sticking the finger and stuff. And someone in the audience was a retired cardiac surgeon, and he stood up during the question section and said, I knew Dwight Harkin, and he was a complete jerk. But he would go around the hospital with this, holding his fingers like, do you know what I can do with this finger? This is a magic finger, he told me, because he would like stick it through the mitral valve. And that was just adding so much color. I didn't know that about Dwight Harkin. I didn't know. I knew Charles Bailey was had this reputation of being not a nice person, but like, that was just so wonderful to hear. Maybe some of you heard of Dwight Harkin or knew people who knew him. So, you know, that kind of thing, I still learn about these people after I did the research. Like, there's so much more to learn. Yeah, I mean, I was mentioning to Dale before the talk, I'm going to be speaking for the 150th anniversary of the Boston Medical Library. So I had a conversation over Zoom with the president, and he read Masters of Medicine, and he's like, but did you know about Oliver Wendell Holmes? Did you know about how he was also promoting hand washing to stop purple fever, which is a story of Ignaz Semmelweis that I shared in the book. And I didn't know the extent to which Oliver Wendell Holmes had actually tried to promote the same kind of tactics, like there's imaginary germs, that's ridiculous. Like, how could we not, as gentlemen, not like be hygienic? Like, that's impossible. There's no such thing as imaginary things that we don't see, right? So in the mid 1800s, so it's incredible. I'm still learning as well. So it sounds like you guys have a great group together and have there's a lot of expertise here and a lot of appreciation.
Right. Yeah. Thank you. Thank you very much.
Excellent. More comments or questions? If not,
I had a quick one.
Okay, Magdalena.
Sorry,
All right.
can I do one? Sorry, I'm Magdalena. I'm a infectious disease doc at UMass. And I have also been involved a little bit in teaching medical students and other trainees in fellowship and residency. And I'm curious, how much or have you in any formal way incorporated your passion for history into your teaching? Because I've tried many different ways of doing it. And
well, every student I have gets my books.
Some has worked and some
but and I will say that I am commonly asked to go speak to medical students or college students or even undergrad, I mean, even high school kids. Yeah, because I mean, I think when you're in medicine and you're young, you don't care about history. You are just trying to make it. You're just trying to survive, learn as much as possible, drinking from the fire hose. But once you're out, right, and you're practicing and you know what to do because you've been well trained, you start to really appreciate what got us to where we are. And then you want to convey that to this younger generation so they know too. And and then some people will say, you know how to ace your residency interviews? It's to like show something about what happened in this field before and where we come from. And so the book gets given away to like entire like medical school classes get the Masters of Medicine, or ophthalmology residency programs get the Saving Sight. Or like drug companies before there were Masters is very restrictive, but in other parts of the country, drug companies can still buy and give educational gifts to some degree. And so that's great because I can really feel like they're learning something that I think will enhance their appreciation for what they're learning to do. And so I'm not really teaching like at UMass, I'm not at the Worcester campus. There's a branch of UMass Medical School at Bay State Medical Center, which is where I practice. So to be honest, at the most, people are just rotating with me who might be trying to get an appreciation of ophthalmology or retina. They can't honestly really even see the retina that well because they don't know how to use the indirect ophthalmoscope. But so I'm not, that's my role at UMass mostly. But I think the education comes when I get to go, like I get invited to go speak to a group of interested people and the attendees get my book, and that just, I can see lights up. Like these people in internal medicine, they have no idea the crazy things that happened that let us catheterize the heart or, operate on beating hearts, or like insulin. The story of insulin's discovery is insane. Like these guys, just like these dogs, like Banting and Best, and then their hatred of each other, where Banting was so upset that McLeod was going to get a Nobel Prize because he thought he so outshined this guy that he almost refused a Nobel Prize. Like the drama is just ridiculous. Humans, doctors are just as fallible as the rest of everybody else, right? So, that's all very dramatic. And in the end, it's just storytelling.
Excellent. Any more?
No, it's fantastic. Thank you.
Okay.
I can ask what I think is probably a short question. Was it you or your book agent who wanted to put in the very detailed and what for some people would find like gory or squeamish details of the ruptured globe surgery in the first chapter?
So that's all me. I think I think that to be honest, so any author knows rejection is 90% of the game. Like I've been rejected by hundreds of agents and hundreds of publishers, right? And this feeling of squeamishness about the eye is ubiquitous. So I think that so a lot of agents said, this is a really good writer, but I cannot read this because it just makes me like freak out. So, and I knew that. And that's why the Masters of Medicine, which is about all of medicine, is much more, it's a bestseller. It's done well in America, but it's a bestseller in like South Korea. It's because in Asia, I think they really put Western medicine on a pedestal, to be honest. So it's going to be way more successful than Saving Sight. I think Saving Sight is got a niche, and I'm passionate about our field, but you're right. Writing a bestseller about eye surgery is not the most likely thing to happen in the world.
Excellent. Other comments?
I love that you kept it in though.
Yeah, thanks. You have to be true to yourself. I'll be honest here. I'll give you another example. And, the cover of my book is my face. And it was mentioned to me for marketing. Now, I'm not saying this at all to get anyone's pity or anything, but I'm like, they said a Caucasian face would sell more copies, to be honest, because they know this. And, we don't have to pretend that like it insults us or anything. It's just literally the fact of life. They literally do marketing studies on covers. Okay. But I'm like, you know what? I don't really care. Like I want to be on the cover because like it's me. And I think that to have someone else on the cover would be like totally disingenuous. So these are the kind of things that as an author, you get to decide what you want. If I wanted Saving Sight, there were things that I could have written. All of us have stories from residency that were horrendous, where people did the wrong thing or things were just done very badly. I could have like written incredible stories that happened in residency. And I even wrote one once, but a mentor read it and said, this is like going to like get our hospital, like this could get our hospital in big trouble, or this could really reflect badly on your like blossoming career, you know, because it's just too honest, you know? So I think that you just have to be true. To me, it was important to be true to yourself. Thankfully, again, I don't have to write for a living, so I can just do what I think is right. But a lot of people, I think, if you know, you might have to make creative choices that aren't ideal to get a book deal, to get a job, to get a movie role, you know? So that's what people sometimes have to do, and they have their own little internal compass that they use. So thanks for all the great questions, everybody.
Yeah.
Thanks for reading the book.
Well, and this is one of the best books we've read. And what a great discussion we've had. We're so lucky to have you join us this evening. Thank you
Yes.
so much for being a part of this meeting with us. Really appreciate it.
Yes.
Thank you.